I'm Don Wallace. I'm chairman of the International Law Institute, and I want to welcome you all. We have a very distinguished panel. Our topic is communications. We've heard a lot of information and misinformation about various aspects of the pandemic and the vaccine. I'm sure we'll hear more about it. I expect that if actions speak louder than words, then one might also think of the activities of COVAX, the distribution of the vaccine internationally, and the issues that has raised, which certainly it may be a form of communication, but it also raises communication issues. Anyway, Yona, I turn everything over to you.
Thank you very much, Don, for your brief opening remarks. I'm sure that you will jump into the discussion today. And I wanted to take this opportunity to thank you and our colleagues at the ILI for their continuing, I think, cooperation, support, and working with us on the security through law and other related interdisciplinary programs in terms of research and publications and so forth. Georgian, we had some of the recent reports, I think, just to mention, also the reports in addition to some of the books that we had, some of the areas, and obviously we try to deal with the communication aspects, the use and the misuse of the communication challenges from individuals, governments, inter-governmental agencies and non-governmental agencies, and so on and so forth. So this we have done over the year, and now this particular event today, obviously we are going to continue with assessing the biological threats challenging the health and security concerns globally, as we have done the past 8 or 9 different seminars and publications and so forth. What is of grave concern, as all of us know, that as of today, according to the available statistics, not fake news, globally, I think the international community recorded approximately or nearly 150 million cases, with the global deaths of over 3,100,000 and so on and so forth. So it's not just the numbers, but the impact of, I think, the threat and the nature of the threat. So again, I think what is important to look at the different terms and concepts, the proliferation of many of the terms, all the way from information or misinformation, active measures, fake news, radicalization, etc., that we're going to deal with, the challenge of cyber and so on. So there is some, I think, disagreement or confusion related to the meaning, the implications, the responses. I recall very vividly that our colleague and mentor over the years, General Al Gray, who was the commandant of the Marine Corps, he famously made the remarks at one of our meetings that communication without intelligence is a lot of noise. And intelligence without communication is irrelevant. In other words, we see the interface between the two. So again, today, we are going to deal with some of the interdisciplinary aspects of the problem. And I would like just to make one more comment in the context of our discussion today to relate the issue, to put it in some real perspective. We are dealing not only with the use or the misuse of the propaganda or governmental communication, but we have to look also at the physical and digital attacks regionally and globally. What we see now everywhere around the world, we see attacks on the personnel such as journalists and the facilities and the equipment and operations of the communication systems around the world. So I think also in connection with that, we have to express, I'm sure, our condolences to those families who suffered the attacks on the media. With that, I would like to move on and to invite our panel. The way we're going to deal with that, in the interest of time, is to introduce the speakers or the panelists in relation to their presentation. A perspective, I think, on the scientific and technological aspects, as well as reliable information, will be presented by Professor Rita Caldwell, who is currently the university professor at Maryland and Johns Hopkins University. She's also senior fellow at the Potomac Institute for Policy Studies. Again, Professor Caldwell needs really no introduction. As we know, she is one of the top specialists in the world in this particular area of global infectious diseases in water and health and related concerns. And all of us recall that she was the director of the National Science Foundations and held many advisory positions, the US government, and some of the policy organizations nationally and internationally. We had the honor to follow her leadership for many years. And I would like to mention one particular book. I see it on the screen, The Lab of One's Own, that came out last year. And we are trying to communicate some of the important messages that she wishes to make sure that we follow closely in order to advance the cause of science, technology with justice and equality. So Professor Rita Caldwell has a presentation, a PowerPoint presentation, and after her presentation, we'll follow up with other panelists, and finally, we will have an opportunity to have a Q&A discussion. Professor Caldwell, please.
Thank you very, very much for the kind introduction and for including me in these very interesting fora. I find them fascinating and very helpful. Communication is truly a vital and critical aspect of the challenges of COVID-19. Just getting people vaccinated is critical, and the misinformation that interferes is a major concern, especially when we're attempting to get to herd immunity. That is, somewhere between 60 and 70% of the population vaccinated. So communication lapses or communication interference literally costs lives. I'd like to use my participation as an update on what we're learning. And if we have a next slide, I guess you're showing them, or am I? Good. I'd like to emphasize that what we're learning is very much like the analogy of building an airplane while you're flying it, because we are literally learning every day something new and usually dangerous about this disease. First of all, the long-term effects. We now know that this is a problem for somewhere around 5% of those who actually become infected. And the symptoms are very extensive, from cardiovascular to blood clots, skin disorders, and even mental effects. We're only now beginning to have the data that allow us to predict the proportion of the population, and we're not quite yet there to determine who will be the ones affected. And secondly, the post-vaccination infections. After the first shot with Pfizer or Moderna, approximately 5,000 cases have, out of many millions, and again, that's critical to point out, this is less than 1%, will have the potential of being infected. That is after the first shot, even before the second shot. We've also learned that after 2 doses of the vaccine, and at a time when you would have expected full immunity to have been induced, we find occasional cases of COVID. But that's the bad news. The good news is that 95% of those who do become infected post-vaccination or post-recovery from infection will not be hospitalized, maybe 2 or 3 weeks of the infection. But still, even if you've had the infection, we're now finding that it's possible to be infected again, but I'll mention the variants a little bit later. So this is a wicked, a nefarious disease. Yeah, the next slide. One of the things that we are learning is that one way to monitor the population is to use wastewater data with reported cases. This gives us about a 6-day advance warning. And so the right-hand graph shows the dotted line when the cases are appearing, but you can see that 5 or 6 days earlier, there were just a few, well, we could pick up the virus in wastewater. To the next slide. I'll go through these quickly. The CDC has established this wastewater detection as a systematic process recommended for states now in the country to do the analyses and then provide the data to CDC so that it can be accumulated and shared. Have the next slide, please. Participation is now almost universal. We still have some states that have not yet begun this kind of testing, but at the same time, they're the same states that haven't been doing the nasal swab or the clinical testing either. We have the next slide, please. The value of wastewater information is that you can determine the circulation of the virus in a city. And I would like to point out that this approach is now international. These are data presented just a few days ago by a representative from the Amsterdam team showing, in the Netherlands, showing how this technique has proven to be valuable in that country. We have the next slide. And circulation in cities can be done independent of human testing. In fact, it's even more effective in terms of early warning than human testing. And the reported cases follow the positive tests by a week to 10 days. Again, these are data from Amsterdam. Have the next slide. The added value of wastewater information is that it's independent of human testing. Everybody contributes, but not everyone will be tested. That is, everybody contributes to the sewage system. Hence, you can determine the circulation of the virus within the population. Have the next slide, please. And this indicates that by testing the sewage, this provides a very wide analysis of the circulation of the virus in the community, and it precedes individuals testing positive by a wide margin, and certainly hospitalizations and deaths. So it's a mechanism that I think will be a permanent public health tool for other diseases aside from the COVID-19. Now the next slide, please. What's really important is that variants are contributing to high transmissibility, and in some variants, even greater severity of the disease. And these variants are appearing not just within a given country, but in most countries, because the virus is replicating rapidly. And next slide. We can see that the mutations and deletions in the nucleic acid structure of the organism, of the virus, allows the variants to be distributed very widely. And these are all different variants, as you can see, just in this case in Rotterdam, in one city, the different variants that have been picked up. Have the next slide and the last slide. This one shows that this one receptor binding domain, that is the portion of the virus that attaches to the receptor sites in the human body, can vary in multiple ways such that the host with the variant can be either highly transmissible, more so than the original, or more infective and more destructive in terms of the health effects. So it's very clear that we have to get control of this virus. And here is where I'm going to look forward to the discussion about communication, because we have to get the population, the global population, vaccinated. Otherwise, this disease is going to be with us in a tragic form for not just the next few months or the next year, but for several years. And so being able to get the populations of the US and of other countries to understand that vaccination and practicing, until we've got this disease under control, practicing the distancing and masking, hand washing, and the various means of self-protection are really critical. So that's my introduction to today's really important forum on communication and the need for it. Thank you.
Thank you very much, Professor Caldwell. As always, your presentation, I think, triggers some questions, but we'll leave it for the discussion later on. Thank you again. We're going to move on according to our program to invite Dr. Ford Rowan to make his presentation. Again, Ford participated in our activities for many years. Currently is the chairman of the National Center for Critical Incident Analysis at the National Defense University. And prior to that, he was a news reporter for about 2 decades. We recall his participation at NBC News or PBS programs and so forth. And his doctorate in public administration, by the way, the dissertation dealt with defending against bioterrorism and the lessons of the 2001 anthrax attack. I may mention that he is also an attorney, and we look forward to his presentation.
Thank you very much, Fiona. I appreciate the opportunity to be here. It's a subject I've grappled with since 1961 when I became a reporter, and I reported for 20 years. And here are some of the things I've looked at more recently after I stopped being a reporter. So we started the National Center for Critical Incident Analysis at the National Defense University in the wake of the anthrax attacks. And we became independent because we wanted to do work with other government agencies, including Health and Human Services. But before we go to the rest of the slides, and these are things that I did work with on the anthrax and SARS and Hurricane Katrina. I floated around in a boat of what came to be called the Cajun Navy, of just guys that came down to help. New Orleans is my hometown, so I got my parents out of New Orleans and went back to try to help with the recovery afterwards. And then I've also worked in the run-up to the 2009 influenza, which I trained public health officials on how to do risk communication before and during. And then I've done a lot of work with COVID-19, on, particularly because I'm on the advisory board of the Berman Institute of Bioethics at Johns Hopkins. Now, if we could go back, before we go to the other slides, I'd like to give you a little bit of information about the work in the media and how that affects that. So we don't need the slides for these right now. First of all, I wanted to say very clearly that risk communication is distinctly different than news media communication. It's just a different type of animal. News media coverage almost always amplifies the risk. It's invariably drawing attention to a crisis type situation and sometimes triggering anxiety. And you can see that nightly on the television news and on the cable stations. Cable news is incredibly biased for reasons that involve money more than power, more than politics. It's really about how do you get your audience, how do you feed your audience? So social media, I'm going to distinguish between the news media, cable news media, and social media. And it's hopelessly biased and suffers from Gresham's law that the good drives out the bad. But let's start with that last item about social media, because it's what I think has triggered a lot of uncertainty and a lot of taking sides politically in recent years. Social media is less likely to reflect reality than news media. Why? Because the news media is sometimes biased, and I'll mention that in a little bit, but social media is almost always biased. And so news media bias, and I'll never forget this. David Brinkley was once asked at one of these big forums way years ago to define how the news media decided what was newsworthy. what is news? He was asked. And Brinkley said, news is what I say it is, period. And of course, he's right. If you cast aside some of the, the pride in that statement, basically, it's what the news media report on. They create stories, but usually those stories, so there can be bias in what they decide to cover. But by definition, the news media is in the business of mediating reality. The underlying media ethos is about accuracy. The facts usually catch up with claims. Social media is not mediated. It's not mediated virtually by anything, but certainly not by professionals seeking accuracy. Now that may all change based on some of the initiatives that have been taken to try to change the arrangement that allows social media the kind of freedom that it's had in the past. I'm not going to get into that today. But when I worked as a reporter, accuracy was 100%. Okay, that's what we cared about. My bosses all said, accuracy is the most important thing and your opinions count for 0%. From day one of employment in the news business in 1964. So it's a long time ago. My boss told me to double check everything. He said, if your mother says she loves you, check it out. So anyway, he also said, I don't care if you have opinions, but I damn well don't want to find out what your opinions are watching you on TV. So it was pretty clear, this was the ethos back then. It's changed since then. It's, like most people who are old, it's been all downhill since I left. I want to talk about risk communication because it is distinctly to be differentiated from news media coverage. It's a different animal. COVID has been so disruptive and for many people traumatic. There's so many dead from the coronavirus. Here, the numbers night after night. Thousands of family members were not able to visit their loved ones when they became sick in hospitals and nursing homes. Thousands could not be present with a dying mother or son or daughter or anybody in the family, child. The funeral may not even have been scheduled or even been held now. Bodies were stacked in a refrigerated truck. So grieving was disrupted. I want to say the psychological importance of grieving is enormous. And it's disrupted by all of this. When talking with someone who has lost a loved one to the virus, it's easy to say something that triggers some of these reactions that people have had, these psychological reactions that they've tried to bury. And it's inadvertently easy to say something that triggers a traumatic memory. There's an epidemic of suicides in this country right now. There's an epidemic in overdoses of addictive drugs in this country right now. And the suicides include healthcare workers, first responders, law enforcers, and veterans. Knowing what to say can be really important. It can have a life or death impact. It can require psychological first aid. There is such a thing as psychological first aid. I've taken the courses in it. It's taught at Johns Hopkins University and at the University of Maryland. Now, I've taught for 12 years at Northwestern's Medill School of Journalism. I don't do that anymore, but I used to. I did it for 12 years. And several of my students are now news reporters of their own and out doing successful careers. I have one that is doing a great job on television talking about the pandemic. I didn't get her permission to say her name, but I really never taught any of them about psychological first aid. I never taught anybody when I was teaching journalism about psychological first aid. And how does communication affect risk psychology? Let's go back to the slides here because I've got one that I think is kind of an important one. It's about how psychological issues are aggravated by political partisanship. And boy, I mean, I could have started this whole conversation by saying the number one problem is the Democrats and the Republicans have been feuding publicly. But it's more than that. It's not just that they're disagreeing. It's that all these messages are complicated by scientific uncertainty. I mean, for example, when they do a pause with one of the vaccines, a lot of people are going to say, what the hell do they know? That's a way to find the answer, but it doesn't seem to come across that way if you're just Joe Blow sitting there watching TV. So these these news stories fuel the fear of the unknown. The public wants answers, but they're hearing falsehoods from some of the politicians. I won't get into the political part of this, but you all know what I mean. Misinformation has triggered resistance to being vaccinated. Social justice has been undermined. I've been doing volunteer work in prisons for 20 years. And the risk of an inmate getting sick with COVID or dying is much higher than it is in the free world. And it unfairly affects Black Americans, Native Americans, Hispanics, and other groups, ethnic groups. So what's crucial is accurate risk communication. If we can go to the next slide, let's take a look at this. Risk communication is defined by the National Academy of Sciences. It's an interactive process, exchange of information and opinion. The nature of risk is about concerns, opinions, reactions to risk messages. I put this slide up there for a very important reason. It's not just about science. We really need to step back and say, what is it beyond science that we really need to think about when we talk about these particular communications? Let's go to the next slide. Some risks seem more risky than others. An unfamiliar risk, like a virus I can't see, is a lot more frightening in some respects than a familiar risk. You know, don't drive 90 miles an hour in a 60 mile an hour, traffic thing. Risk I cannot control always seem worse than controllable risks. I mean, for example, my father smoked 3 packs of cigarettes until he died at age 88. That was a controllable risk that he couldn't control, but he became unable to control it. But at the beginning, it was a controllable risk, but it became an uncontrollable one that he couldn't stop. There are involuntary risks versus risks I choose. Risks I choose are never as scary as the involuntary risks. Risks with no benefits seem to be risks I don't want to take versus the risk with benefits. For example, tonight I'm going to have a glass of wine. There are some risks involved in the glass of wine, but I like the benefits of it. Here, finally, risks that are seen as unfair are scarier than risks that are shared broadly across society. Let's go to the next slide. So risk communication is not just about the science, it's about power. The power of who knows, the power of who decides, the power of who controls, and who benefits, and who must pay. I mean, there's going to be a cost in all of this, and it's fallen disproportionately on poor people, workers, as well as the owners of some of the establishments, like food and hospitality. I mean, there have been some really disparate groups that have been badly affected by this. And let's go to the next slide. So if we're going to talk about risk communication, why is it crucial? And why is it crucial it has to be accurate? First of all, because you want to empower people to make decisions. And that people expect honesty. Leaders have to communicate honestly with stakeholders. Incidentally, in the study of some of these prior problems that I mentioned earlier, for example, the anthrax attacks and SARS and the hurricanes and the rest, the failure to communicate honestly really undercut the response. So transparency is important. Also, appeal to people's own best interests. Every time I hear the word lockdown, I cringe. Shielding would be a better way to talk about it, but it's not the official title. They thought about doing it that way in the UK. But lockdown comes as a prison term. Having been in a situation in prison when there was a lockdown and thus volunteers had to leave, I understand what a lockdown is. It ain't something you want to voluntarily have to be involved in, okay? So what you want to do with risk communication, and this is which is different than media or social justices or social media, is you want to inspire people to help each other. So basically, if you're going to do this kind of communication, do not wing it. It's better to think about what you're going to say before you open your mouth. And it's really important to be truthful, because trust is hard to renew after people have lost it. Trust is essential in these sorts of things. Let's go to the next slide. Or maybe that's it. I can't recall. Sometimes I get ahead of myself. So let's get back on camera then, I guess, at this point. I want to end with something that I learned a long time ago. You know, I don't want to just sit here and criticize the news media. That's what old guys do when they talk about their prior careers, you know. I'm a big critic of a lot of what they've done, especially because they've catered to the political polarization that's going on, and it bothers me deeply. But I want to say, I wanted to include in this what could be done right. And the best advice that I have ever read about how to communicate accurately and effectively, that's the key, effectively, is kind of ancient. It comes from Aristotle. Aristotle said that the first thing you have to do is to understand the audience's concerns, their fears, their hopes. What's the audience pathos is the word he used. The second thing you need to do is to see if your own ethical character aligns with these concerns. This is the ethos. Does it align with the concerns that others have? This is your ethical character. And the third thing that Aristotle said is then you can utilize effective reasons. And he uses the word logos. So the logos must align with your ethos to address their pathos. Now, in other words, effective communications must, number one, ring true with the public. Number two, be true to you, the speaker. And number three, be true, period. To resonate, it must be authentic and accurate. And I hope this has been useful, not just to talk about critiquing the news media, which we could do for a long period of time, and to talk instead about ways that this could be made to be a more effective communication, risk communication. Thank you very much.
Okay, thank you very much for your presentation. Again, obviously it's the beginning of discussion, and I think we have to agree on some definitions. What does it mean, the use or misuse, or the question of those who are first responders, including now maybe the reporters, because of the risk or danger to their life and their facilities and so on. So we'll come back to it a little bit later on. At this point, I would like to introduce Dr. Wang Tang, who is a professor of journalism and mass media law and director of journalism broadcasting at the department there at Western Illinois University. And he is teaching a wide range of courses on journalism and mass communication and so forth. Particularly, I think his research focusing on freedom of information and mass media law and international journalism and so forth. He was a reporter for many years, also worked in China and US, and participated in many of these activities. At this time, he's going to make a presentation, a PowerPoint presentation that will deal particularly with the role of freedom of information law in Chinese and American response to COVID-19 pandemic. Professor, it's all yours.
Good afternoon, everyone. So my name is Yong Tang. Professor Yongnan Alexander, thank you so much for inviting me here. So at the very beginning of the seminar, you said intelligence without communication is irrelevant. I can't agree with that statement more. Okay, so today I'm going to have a presentation about the rule of freedom of information law in Chinese and American response to COVID-19 pandemic. Okay, so my presentation will cover 5 different parts: China's freedom of information law, and how the law played in the pandemic, and U.S. freedom of information law, and how the law played its role in COVID-19 pandemic. And then at the end of my presentation, I will talk about lessons and some of my personal thoughts. Okay. Okay. So China's freedom of information law. I want to say a few words about this law so that you guys can have more context about this. So Sweden created the world's first freedom of information law in 1776. And one of the creators of the law said he was inspired by Tang Dynasty, simply because one Tang Dynasty emperor allowed his advisors to record his everyday movement and everyday actions, and allowed them to criticize him when they feel he was wrong. Okay, then USA became the world's fourth country to have freedom of information law. And then finally, freedom of information law returns to its home in 2007, when China passed Open Government Information Regulations, so abbreviation as OGI regulations. So this law was created simply because in 2003, there was a huge crisis, a crisis very similar to what we are experiencing today. It's called a SARS crisis. SARS crisis, SARS virus is very deadly, but of course, it's much less deadly than what we have today. And then the law took effect in 2008 and was revised in 2019. Just like every freedom of information law in the world, Chinese freedom of information law applies to all levels of government, people's government throughout the country, including administrative agencies, public universities, and public hospitals. And the law does not apply to the Communist Party. It doesn't apply to courts. It doesn't apply to People's Congress. And so it has a proactive disclosure requirement and a reactive disclosure requirement. So simply, according to the law, the government agencies at all levels have a legal obligation to both proactively and reactively disclose any government-held information that is not exempted, okay? And the law, Article 6 and Article 20 says very clearly that government agencies must emphasize proactive disclosure of government information involving public health, and disclosure must be timely and accurate, okay? Any citizen in China can apply for government-held information that is not under exemption and is not proactively released. The government agency must reply within up to 30 business days. And if their application is rejected, and they have, they can pursue administrative reconsideration or even a lawsuit. Okay, then let's move to the rule of FOIA law in China's early response to COVID-19 pandemic. So National Health Commission, Hubei Provincial Health Commission, and Wuhan Health Commission, they are all government entities directly responsible for management of the outbreak. Unfortunately, they all failed miserably to proactively disclose what was going on in Wuhan, the original epicenter of the coronavirus outbreak. And Caixin, so Caixin is a very famous, prominent news media outlet in China, and it's pretty Western style news organization. And they're very good for investigative journalism. And Caixin found that government efforts to conceal information, destroy evidence, and penalize whistleblowers did exist at every level. And according to Caixin, the Provincial Health Commission in Hubei province began actively suppressing scientists' knowledge about the virus as early as January 1st, 2020. Okay, in February 2020, a lawyer in Hubei province applied for disclosure of COVID-19 related information held by various government agencies in Wuhan, Hubei, and Beijing. He wanted to know what happened in Wuhan from early December 2019 to January 2020, and how various government agencies in China responded to this crisis. Unfortunately, none of his requests were approved. And another thing, no reporters in China used OGI regulations to apply for COVID-19 related information. So from freedom of information law perspective, I think China did failed miserably. Of course, from the government perspective, I think it did a very good job in controlling the information. Okay, so then let's move to the American part. So U.S. freedom of information. Did U.S. do a better job? Okay, so let's say a few words about U.S. freedom of information law. Freedom of Information Act, or FOIA, was signed or into law in 1966, reluctantly by U.S. President Lyndon Johnson. So no government in this world, wants to open itself. So reluctantly, it's understandable. And many amendments have been made since then. And like many other freedom of information laws in the world, it compels federal agencies to proactively and reactively disclose information that does not fall under the 9 exemptions. Okay, and once the government agency receives application for information disclosure, it has a legal obligation to respond to a request within 20 business days. Okay, so just like Chinese freedom of information law, U.S. version gave citizens option to pursue administrative appeal or even lawsuit once their application is rejected. Okay, and the FOIA applies only to federal agencies. You have to keep this in mind. It's very important. It does not apply to records held by the president, the president's immediate personal staff, White House office, Congress, the courts, or state or any local government agencies. And later, all 50 states plus Washington, D.C. have created a similar open records laws. Okay, then law is here. Then let's see how the freedom of information law played its role in U.S. early response to COVID-19 pandemic. So here we have some important timelines. Former President Donald Trump was briefed on the dangers of the COVID-19 virus in January 2020. Trump knew in February that COVID-19 was deadly stuff, but wanted to play it down, according to the Washington Post. And then Donald Trump didn't declare a state of national emergency until March 2020. So Trump didn't have the legal obligation under FOIA to disclose timely what he knew, because FOIA doesn't apply to him. But he had a moral and ethical obligation to do so. So did Trump share the COVID-19 related information with any federal agency, such as CDC or U.S. Department of Health and Human Services? I don't have, I can only guess at this point. I think I don't have enough evidence to say if he shared or if he not. So if he did share, the critical piece of information with federal agencies, and then CDC or Department of Health has a legal obligation under FOIA to disclose, at least in February, the true seriousness of the virus. So it can spread through air without causing any symptoms. So unlike what Chuang Ladam said about the virus at the very beginning, it's a common flu. So CDC and the Department of Health didn't tell the public the truth until very, very late. Okay, then let's turn to reporters and let's see how they did their work in the pandemic. So Bob Woodward, a very famous guy in the world, he's my journalism icon. He knew the virus actually was very deadly in February 2020. So in a telephone conversation with Donald Trump. But unfortunately, Bob Woodward withheld the information until September 2010 when his book was published. And Woodward, I think, failed miserably this time, unlike what he did, about the Watergate scandal in 1970s. He should have he should not wait for so long to alert the world. And he should have interviewed more people or even filed a FOIA request to say what Trump said to him, is true or not. And the Washington Post and other major media organizations did not file any FOIA requests for COVID-19 related government information until very late. So here at the end of my presentation, I have some lessons and thoughts to share with you guys. And so why China failed so miserably this time? And I have several points here. So first, it's about China's, FOIA exemptions. So the law is inherently weak because of its exemptions. So according to the law, state secrets should not be disclosed at any time, and information involving commercial secrets, personal privacy, information whose disclosure may endanger national security, public security, economic security, or social stability should never be, disclosed at any time. So unfortunately, the law doesn't give any specific definitions about what is national security, what is public security, what is economic security, and what is social stability. They are all very vague terms. So government agency officials can use those terms to deny disclosure whenever they wish. And then the second point is about the legal standing of OGI regulations. OGI regulations are not called the law, Freedom of Information Law, simply because it was passed by the State Council. It was not passed by People's Congress. So its legal standing is very weak. So we cannot expect such a weak law to play a bigger role. And thirdly, I think we have very limited journalistic use of OGI regulations in China. And the Chinese reporters don't feel very comfortable using OGI regulations to pry open government secrets. So they normally use personal collections to get connections, to get information from government agencies. And then last 2 points. So a political culture of increasing authoritarianism, I think is returning to China, and unfortunately under the new leadership since 2012. And so under this culture, you cannot expect government officials to be very open. And so everybody just wants to hide, corruptions, negative things from higher officials. And then lastly, low meaningful international pressure for greater transparency. To be honest, I think China, doesn't have a lot of international pressure for greater transparency, and it has a lot of international friends like WHO. Lots of international organizations are very friendly to China. So if the country didn't, become very open and transparent, it will not face any repercussions or penalty. Okay, then let's move to the U.S. So United States is a democracy. We should do a better job, right? But unfortunately, United States failed miserably, just like China. So what's the reason? I think I listed 4 points here. The first is about White House privilege. That's a term I created. So what is White House privilege? It means that freedom of information law does not apply to the president. It does not apply to his immediate personal stuff. And so it doesn't apply to White House office. And you cannot FOIA White House. You cannot FOIA Donald Trump, at this point. You can only FOIA White House. You can only FOIA Donald Trump 5 years after he left his White House. So that's 2026. No, that's too late. I think that's a big problem. I think it's ridiculous. So in my opinion, I think the law should be amended, should be revised to allow the law to apply to the president. That's the point of government transparency, and the president should be held accountable, and the law should be changed to get rid of White House privilege. And I don't think this disappearance of White House privilege will damage American national security. So the White House can use 9 exemptions, right, as a shield to reject disclosure. So And then the third point is about journalism. I think journalism is dying. I teach journalism. I think it's which is very sad for me. I think especially investigative journalism. I think so many news media outlets today are closing their doors, and for those media outlets who are still alive, and they are struggling financially, and they're laying off staff, reporters, and they don't have lots of financial resources to conduct investigative journalism. So that's why we have so few freedom of information requests from media outlets. I think the third point is about increasing culture of secrecy since after 9/11. Since after 9/11, this country has adopted a policy of anti-terrorism. So the country prioritized anti-terrorism. I think actually today, I think we should make some changes to this policy. I think we have lots of threats to American national security. Those threats are even much bigger than traditional terrorism. For example, misinformation on social media. I think it is even bigger, national security threat to America. So we can talk about this later when we have Q&A. And lastly, I want to say that the pandemic is becoming an opportunity or excuse for government officials to justify covering up, for government agencies to cover up incompetence and corruption. So they can use this as an excuse to justify, denying information release. Okay. So basically, that's my presentation. Thank you so much.
Thank you very much for your presentation at this time. Obviously, it underscores the complexity of political communication, persuasion, propaganda, if you will, and the rule of law. Obviously, we will come back to some of the points that you raised, including some questions related to that, the role of technology, for example, the cyber, particularly as we see now from China to discredit US vaccination and responses and so on, but we'll come back to it a little bit later on. I would like to follow up with our program and to invite our colleague, Ambassador Charles Way. Are you there?
I'm here.
Welcome, welcome again. I think many of us worked with you over the years. Look forward to your insights, not only as a diplomat, but also as a soldier for about 20 years, I think as a diplomat for 30 years. And I think your insights are most useful for all of us. In the past number of years, we try to find some way to collaborate on the role of diplomacy in world affairs. And I may also mention that in addition to your very distinguished career in diplomacy in Africa and in Asia and elsewhere, but also you work in the Pentagon as a Deputy Assistant Secretary of Defense for POW, a great human concern. And I think in terms of your journalist and author of many, many books, in terms of how to communicate on different topics is most useful, and we're grateful for your contribution to our work in this area. So Charlie, it's all yours.
Thanks, Yona, and thanks for including me in this important event. At the risk of repeating a lot of what Dr. Rowan has already very eloquently said, I'd like to make a few brief remarks about the importance of leadership communication in situations such as we're facing now, whether it's a pandemic or whether you're an ambassador in a foreign country that's experiencing turmoil and you're having to evacuate Americans to safety, we can't underscore the fact, I don't think we can minimize how important good communications is to managing these events. I mean, you could say in a way that while the vaccine is important, while the social distancing methods are important, in a way, communications is probably even more important, because without effective communication, you can't deploy these other methods to good effect. There are a number of goals, I think, of communication, leadership, and by leadership, I mean the political leadership and the administrative or bureaucratic leadership as well. Leadership at all levels has a number of missions. One, it is important that in an emergency, that the leadership maintains open lines of communications with all of its citizens, with all members of the organization, and that it endeavors to communicate completely, accurately, and in a timely manner. Because there are a number of things you want to get done as a leader in an emergency. You want to build trust. If the people, be they the citizens of a country or members of an organization, don't trust the leadership, then very little of what you try to do is going to be effectively done. You want to make sure that your message is consistent. You cannot have, as Dr. Rowan said, you can't wing it. You can't have different people saying different things, because you will erode trust. You raise the level of anxiety and fear in people, so you've got to be consistent. You have to make sure that your communication counters misinformation and disinformation. I mean, when I was an ambassador and we had emergencies, we always had what we call a rumor control element of any of our emergency plans, and that is an aspect of your communication plan that is specifically directed at countering or correcting misinformation and making sure that people get the right information that they need to make informed decisions. You want to make sure that your communication is a call to effective action, that you are guiding people or giving people the information they need to enable them to make the right decisions and to take the right actions. And finally, your communications has to show empathy. You want the people you're communicating with to get the feeling that you know what they're going through, that you understand, and that you're with them, in other words. And while this is important on a domestic level, in communicating to your domestic population and communicating to people within your organization, it also is true between countries and between organizations. The leadership of countries and the leadership of organizations must, when communicating with each other, follow these same principles. And this is especially true in something like a pandemic, because withholding information, providing incorrect or untimely information endangers us all, and it's something that has to be kept in mind. And again, I really thank Dr. Rowan for an outstanding presentation. I took copious notes. I'm going to steal a lot of what you said in future papers that I write. And I thank you for listening to my aged ramblings. Fiona, you know how I am. I get started talking and it's hard to get me to stop. But I think that this is a very important topic, probably one of the most important topics we've covered in relation to this pandemic, and that is the importance of communication, of effective, accurate, timely communication in solving this problem and in making sure that it doesn't get any worse than it has. And thank you very much.
Thank you very much, Charlie. We'll come back to you, of course, to discuss some of your recommendations to improve communication on all levels, particularly the leadership, and somehow to instill trust in the public with what the government is trying to do. At any rate, we'll move on now. We would like to invite, as we say, His Excellency Pierre Simonovich, Ambassador of Croatia in the United States. Are you there, Ambassador?
Yes, I am, Yona. I'm here, Professor. Hi.
Wonderful. So I will let you speak in a second to indicate that you were kind to join our academic work for the past number of years, particularly last year when Croatia held the presidency of the Council of the European Union. And we're grateful to you for your contribution to our research and publications. I may note here that in addition to his very distinguished career in diplomacy, also serving around the world and as ambassador also in Israel and so forth. But what I really was impressed, Mr. Ambassador, that you tried to move from the academic perspective into comparative literature and languages and so on. And particularly, you also moved, before you joined the Foreign Service, into journalism and the media, and you served in Paris, also in London, I think, at BBC and elsewhere. So I think you have a great deal of experience, not only in terms of the role of diplomacy and the role of communication diplomacy, basically, but also more generally dealing with political communication, persuasion, and credibility. Mr. Ambassador, it's all yours.
Thank you very much, Professor, dear Yona. Thank you very much for inviting me, and thank you very much for your kind words. Ladies and gentlemen, always a distinct pleasure taking part in these webinars. This is indeed a most topical and I would say critical issue, and it has clearly been from the very beginning, and it remains, and it will be in the foreseeable future, meaning the relationship between the crisis topics such as the actual ongoing pandemic and the way how all things get communicated on the pandemic. And I surely can start with the I was formed as a journalist, and having said that, I would also add as a BBC journalist. So there was I'm not sure that the BBC has attained the perfect objectiveness and the perfect accuracy, if there is such a thing. But surely the fact is that it is one of the global news media organizations, particularly BBC World Service. I used to work for the radio. Was at least striving, making best efforts to achieve that kind of accuracy from which trustworthiness should stand for. And sometimes I remember from my experience, sometimes that was a very frustrating exercise, because it's if you follow your first impulses, it's much easier to be biased. It's much easier to go sensational. It's much easier to go tabloid and yellow. It makes much better headline, and it sells better. Sometimes, and I remember being frustrated at the BBC concerning certain particular topics, striving for accuracy, making an extra effort in order to ensure that what you're saying is truly accurate, that it stands, that it's triple checked, 4 times, 5 times checked by all available sources. It takes an effort, and maybe it doesn't make such a good headline. And as it has been said in the previous intervention by Dr. Rowan, I think what we see is really what we see. I used to work for the BBC. That was in the 90s. That was before the a full rise of what we have today, internet, and the full rise certainly of social media. The news media were much more structured. This is not to say that there were no misinformation and disinformation. That has been for the dawn of human interaction, I guess, existing parallel with the efforts to have accurate communication. But what we have today, and it intersects in a most critical fashion with the deadly pandemic we are facing, is truly a cacophony. It's the essence. So basically, what we have while dealing with the communicating pandemic, let me put it that way, is a part of a much wider issue of relevance in today's communication and information world. And in a nutshell, I guess the problem is that a lot of people, or maybe almost everybody, apart from a handful of enlightened professionals, look at what gets published or what gets circulated around the world, news-wise, blog-wise, social media-wise, that everything, the scientific work, peer-reviewed, equals, it gets perceived on an equal level of trustworthiness and relevance as somebody's blog, as some communication on the social media, and as something a respectable news media organization is publishing or circulating. And it takes a lot of effort and knowledge and insight to be able truly to distinguish what is what is a total nonsense, what is the fake news with the certain idea behind it, or what is something truly accurate and trustworthy. So for many people, and that is I guess natural, unfortunately, faced with this cacophony, they perceive almost everything on the level of being equally accurate and being equally relevant. Even if that is not the case, given the amount of information we are all facing, I can take that from my example. When you read a lot, when you surf, for example, on a particular issue, you find such an enormous amount of totally opposite, conflicting information, and you may have your opinion, and you may make up your mind in an enlightened fashion. But the problem is that everything else you read also, up to an extent, pollutes your mind, and it throws seeds of doubt into something which may be accurate, particularly if that truth is unpleasant to your ambitions, your ideas, or your whatever you believe in. So it is part of a much wider problem created by the basically, in a nutshell, by internet, which has enormously empowered people, which has facilitated, which is basically a lifeline, a communication lifeline during the pandemic. But on the other hand, it comes with some strings attached. And now today we are talking about these strings attached. We have to live with. If I may approach the issue in a bit of a systematic manner, I would say that looking at the communicating pandemic, this pandemic, Professor Caldwell named it rightly, I would say, wicked and nefarious disease, which is ravaging the world, our lives, economies, and the global and national politics. I see two main problems in a more precise sense. One of them is that the tendency which was existing, which is still existing, and presumably it will exist, of playing down the threat. Playing down the threat actually enabled the threat to become so large, and it was surely hampering enlightened efforts and endangering public health. Why is this playing down the threat happening? I think one of the reasons is that simply there was almost a natural instinctive reaction to such a thing, to wish it away. It was simply interfering with a lot of plans people were having at any level, any given level. It may not be so important if it is happening on a very personal level, but if it is happening at the level of decision makers, then it becomes a much wider public problem. If you're playing down the threat based upon it doesn't fit your plan. That is happening in many countries. That has been happening all over the place. That led, again, almost instinctively to the misinformation, disinformation. Apart from the fact that that was that the communication on the pandemic has also been weaponized for some particular interests of some states, which is a different matter. What I would then playing down the threat has been one of the major problems when it comes to the effects of the misinformation and disinformation associated with the communication on the campaign. The second one is anti-vaccination movement, stemming from some ideological and political agendas, usually, and also very much multiplied, made possible up to an extent, and multiplied by the spread and the speed with which the communications are getting exchanged these days. But this is not something new. I was just today in New York Times, I was reading a good article from David Motadel, a historian at the London School of Economics, reminding us that the anti-vaccination movement and the all crazy things we are seeing today, anti-science movement, belief in most extraordinary and outrageous fake news, was actually Britain experienced it in the 18th century when they were vaccinated against smallpox. Basically, one of the things that people believed at the time was that that vaccine is turning essentially mutating people into some kind of cows, which is not that far away from what anti-vaxxers are saying these days. Maybe that is a bit of really a very serious example, but it's not something which has not been seen, something which we are not experiencing. The whole issue of how the pandemic was communicated was very much influenced, was very much visible whether a society, as a state, was ultimately more or less successful in confronting and dealing and managing the pandemic. And then you see that the countries which were able to do better were actually doing the communication better. But it's not only communication itself that what was making them deal with the pandemic better, but the fact that the people believed the elites or the ruling elites more, and they were able and willing to accept what they were saying. If you had that elite in power, the logic would be that they were like believing in science and that they are realizing the threat and they're implementing adequate public health measures, then the results were better. So the prerequisite was to have that elite in place, elite which is rooted in science and which enjoys a high level of support from its citizens, based upon its transparency, accuracy, and honesty. These countries, these societies were doing far better than the other societies, which, when you look at the societies which were not doing better, which were not doing better, being an understatement, which were very basically some of them an outright failure. Those countries, the ruling elite of those countries, were very much divorced from its own public. They were not transparent, and they were for the sake of their own politics. Basically, they were playing politics with the deadly pandemic instead of confronting it in a scientific manner. They were doing far better, far worse than the societies which are approaching it differently. What we will be seeing in future, we are unfortunately, it doesn't seem some countries, some societies have learned these truths the hard way. Some of them were able to anticipate and behave differently from the onset, and some of them, I guess, unfortunately, will be still stumbling around, being torn apart between those who are communicating pandemic by playing politics, suiting their own ideological and political needs, and those who would be uncertain about what actually the vaccination means as the only way out of it by creating an adequate herd community, and they will be again, for their own ideological or political needs, lagging behind when it comes to the introducing adequate public health measures and the vaccination measures. Thank you very much. I just wish to provide you with some of the thoughts I have on that, based upon our earlier discussion and based upon my own observations. Thank you very much.
Thank you very much, Mr. Ambassador. We'll come back to you. What I would like to do now, in the interest of time, is to perhaps go to our colleagues and ask them whether they have any particular question or comment, and to develop some sort of discussion. And later on, we'll see if some members of our audience, nationally and internationally, have a specific question. So, Professor Caldwell, do you want to take this opportunity to make any additional comment?
No, except that I did see a question in the Q&A asking whether more variants could emerge from the Wuhan, in addition to the Wuhan, South Africa, Brazil, and UK, and the answer is yes. It's happening every day. We're getting new variants. Whether it'll be as devastating as these others is another question, but the likelihood is high. And then the other question was, is traveling a big risk to add to the potential threat? And I think traveling needs to be done carefully. For example, I'm going to make a trip to California to see a daughter that I haven't seen in a year, now that I've been vaccinated. but I've chosen to go nonstop rather than taking any trip that requires a stop or two, mainly because it isn't so much flying as it is going through the airports. That's a problem. That is the greater risk. And so I think being very careful is being sensible. So that's my best advice. But other than that, I have found the discussion by the other presenters amazing. I find it a really, really good summary, and I just wish that we had had this in February, March of 2020.
Thank you very much, Rita. We'll have other opportunities to have your insights. I would like to move on to Ford Rowan. Do you have a comment or question at this time?
Just a really quick observation, and that is that the reentry process of getting people back into society, back into the workplace, back into school and all the rest is a really tricky period of time. There's uncertainty about it, and there are feelings of powerlessness by folks who are trying to decide whether to send their kids back to school and what are the rules going to be and what are the procedures going to be. And one of the challenges for our society is to try to figure this out. Now, I don't believe it's been quite mentioned this way, but one of the challenges we have in America is that the states and the local governments and the federal government are three different levels, and they're often doing different things. I mean, here in Maryland, the local counties, I live in Annapolis, the local counties are deciding what they want to do with, whether people can walk around without masks on downtown and things like that. And we don't have any kind of a national approach to this. I'm not sure if that's a good thing. But one of the last things that I really would want to impress people about is this reentry period is a time when there's going to be a lot of psychological stress. And it's really important to try to help people because so many people will feel powerless. The victims feel powerless. The survivors often feel like victims. I want to repeat that. The survivors often feel like victims. The goal is to try to turn survivors into something better, which is called rescuers, to help them to help other people, to rescue other people in need. This is one of the key things that we found in looking at how people adjust if they've got something productive to do that helps to contribute to the public good.
If I may ask you for your view, since you were also working as a journalist, how do you deal, actually, you're talking about psychological impact, let's say the spread of fear, mistrust. Do you think that the news reports, they cause or encourage that kind of psychological negative, if you will, impact? Is the media's responsibility to impose some sort of censorship on some of this reporting? How do you deal with that, particularly in a democratic country?
Oh, that's a nice, easy question. Let me first say that being reasonable is something that ought not to be mandated. It ought to come naturally to people. And for example, the media already self-censor. That's probably too strong a word. But for example, with video of people who are ill, they often fade up the face of the juveniles in the picture so that you can't identify the children because they're protecting their privacy, and they don't have to. I mean, they could run the whole tape if they wanted to. So there is some self-control, I'll put it that way, that I'd like to see more of. But look, invariably, anytime the press covers something, press, including newspapers and TV and radio and cable and all that. Anytime they cover something and attract attention to a problem, they're basically amplifying whatever that risk is. And I don't want them to stop doing that if they're being accurate, because we need to know. For example, early on in COVID-19, the problem was, and it was mentioned earlier, Donald Trump has decided, I wanted to try to get through this hour without mentioning his name. He knew that this was a worse problem. than he was saying. I mean, he was basically trying to hope it away. Let's hope real hard and maybe it'll go away. Well, hope is not a good substitute for action. And it's really, I'm sorry I had to bring up the political part of this, but the media jumped all over that when they found out from Woodward that he knew about this all along, and he could have explained a lot of what was happening if he'd have done it in the Washington Post instead of waiting till his book came out. And I appreciated those comments that were made earlier. But one of the things that I really want to stress in answer to your question is we need a sense of responsibility about how we can help people understand that there are successful things going. And when you saw the coverage of COVID, you did see the people applaud the patients that were leaving a hospital. You did hear a really rational discussion of how do you ration a scarce resource like ventilators? And this is a really difficult question. It's one of the ones that the advisory board on bioethics at Hopkins at the Berman Institute of Bioethics has grappled with. How do you try to figure out how to handle scarcity if you can't save lives? And if you're going to, and God, I've got to say, what's happening right now in India is absolutely tragic. It's just an enormous, incredible problem that's happening in one of the largest countries in the world. And I don't want to ramble on about this, but describing a situation will always amplify the risk in the minds of some people. One of the things I do like about the news media, especially the half-hour news shows that they have on the network news in the evening, is they always try to end with something upbeat. And so we've seen some success stories. Let's not eliminate the success stories, because people need to be turned into rescuers. They need to be encouraged to do things. It's not just sit there and stare at the TV and condemn everything that's going on and hide yourself from, from the virus. It's about getting out and helping other people.
Okay.
Professor Alexander? Professor Alexander?
Yes.
We have a question from the audience for Dr. Rowan.
Okay.
Dr. Rowan, this question is from Professor Santamaria in Spain. She says, or asks, Dr. Rowan, here in the EU community, communication on COVID-19 has been rather controversial in general terms, but especially from the psychological point of view. As you very well said, social perception has been fueled by fear of the unknown. Do you think that it is possible to redirect this situation and make social perception to be more balanced? Thank you.
Well, it's a great question. And let me just say that if the fear has been heightened because of fear of the unknown, the remedy may be no more. Understand what's happening. Knowing something tends to reduce fear. In fact, that's a process that the government spokespersons and the news media can certainly facilitate.
On this question, can I ask Ambassador Simonovitz maybe for his view, simply because it relates some way to the European community, because freedom, press freedom, and the situation in Europe is somewhat mixed. And in terms of your experience holding the presidency of the Council of the European Union, what do you think the situation now is, looking at the scene in Europe in terms of the respect for freedom and pluralism, which is a major principle of the European community?
Thank you very much, Professor. Yeah, I guess the European Union, like almost everybody else, was caught unawares, and it was changing its policies on the fly. Also, when it comes to the European Union, in many aspects, when we're talking about the communications, it is true that you have something which gets communicated at the level of the European Union, but then you get something which is communicated at the level of national governments. forming it. So you have a different level of how it works. But it has been very much on the side of the national governments, how they were, each one of them was particularly addressing the pandemic, given the local circumstances, local politics. The one would have expected that more things could have been, even more things could have been agreed at the meaningful level of the organization as a whole. In some aspects, that has been achieved. There were ups and downs. For example, finally, at the end, or almost at the very beginning, European Union was great in agreeing to a joint package, support package for the member countries when it comes to economic support. And it at the end, it also now is doing well when it comes to the vaccination campaign. But again, there were ups and downs. Very small number of countries was really, even maybe the most important, the most successful countries of them all, which was actually facing a major pandemic, because some of the countries which ended up successful were not facing a real disaster. Maybe New Zealand, Australia, they were able to cut it in the bud. But for Israel is an example of a country which was facing a disaster of a first order of magnitude, and due to a set of strong measures, including the measures of public health and the ultimately of the most robust vaccination campaign, I think Israel is an example of a country dealing with it very successfully at the end. But it has suffered a lot in the meantime.
Okay, we'll move on now to Professor Tong. Are you still there?
Yes.
Wonderful. Do you have any particular comment or question at this time?
Not yet.
Can we ask you
Sure.
to comment perhaps in relation to the cyber challenge that we have? Either we are going to solidify isolation, or perhaps reconsider and move on to international cooperation. How do you see that kind of challenge, which is part of miscommunication from the technology point of view?
Okay, so as I said before in my presentation, I think cyber misinformation, disinformation or propaganda campaigns launched by hostile foreign powers, I think that's a bigger issue, bigger national security threat to the United States than terrorism at this point, I think. So many news reports from Western countries found that China, conducted lots of misinformation campaigns about COVID-19. So one big example is about the origin of the virus. Okay, so the Chinese Foreign Ministry foreign spokesperson personally tweeted on his account that the virus was brought into Wuhan by the US Army. And this tweet was widely shared and also translated into Chinese and shared by many Chinese netizens. Okay, that's I think that's a very good example of this information campaign. And lots of my friends, both here in the United States and China, strongly believe that this virus, first emerged not in China, but in the United States, and it was created by a US lab and brought into China by US Army. And lots of people believe that, okay? So that means that this misinformation campaign is pretty successful, and many people have been brainwashed. I think that's a very big problem for the United States, for the future of American democracy, for the future of American journalism. I think at this point, I think foreign powers, I think, have done a lots of misinformation campaigns against the U.S. on U.S. social media. Because of the openness of U.S. social media platforms, foreign powers are able to launch their campaigns here, targeting our, younger generations or even older generations here about COVID-19, about even general elections. And so normally so they do this in 2 ways. So first, they will ask their employees. So like, Ministry of Foreign Affairs spokesperson, he has a Twitter account. And all the foreign diplomats based in foreign countries have social media accounts, Facebook accounts, Twitter accounts. And so the party will ask those diplomats to promote the pro-CCP and pro-government narratives. Okay, that's one part. Second part is about astroturfing. So, and lots of hijacked accounts and ghost accounts were used, or even robots were used to spread misinformation automatically on social media. Amplifying the voice of the pro-CCP narrative. So I think working together, the campaign has been pretty successful in changing the narrative of the COVID-19 story, and has successfully shifted the blame from China to US. Okay, from the long term, what can we do to solve this problem? I think it's a big problem. So, misinformation campaign on social media. Can we, what can we do? So I have seen a couple of solutions. One is about disclosure of speaker identity. So basically, this is asking a foreign speaker to asking the social media company to identify the foreign speaker. Okay, so if you are coming from, for example, the People's Daily website, and this Twitter account will identify this tweet as coming from, the government-sponsored newspaper of China. But to be honest, I don't think this works very well, because most people, when they look at tweets, look at Facebook posts online, everybody is in a hurry. They don't have time spending on the disclosure statements. Okay, they just skip that part. So that's the first solution. Second solution, media literacy. So many scholars mentioned about media literacy. I think this suggests that media literacy courses should be created from grade school. I think that's a great idea. That's a great idea. But from what I know about my kids' high school, they don't have high media literacy courses yet. And even in my university, media literacy course is not listed as a general education course. I think that's a good idea, but I don't think this will work very quickly. It's a long-term solution. It might work from a long-term perspective, but in the short term, it takes time for it to become effective. And can we create a new law to fight against misinformation or disinformation campaign launched by a hostile foreign power? Personally, I agree. I think this is a great idea. So if we make sure that the law is well-defined, is narrowly focused, I think the law will be able to pass the constitutionality test. Okay, if those information campaign aims to destroy democracy, aims to destroy the purpose of First Amendment, then why can't we fight back? If we don't fight back, if we stay idle and do nothing, we die. So, American democracy will be doomed. So even from the purpose of self-realization, self-governance, truth-seeking point of view, I think we can make an argument that such a law could be made to target foreign misinformation on social media.
Very much. Thank you. I just have one more question to our colleague, Ambassador Charlie Ray. It's really an easy question related to your experience in Africa and Asia, for example, the Middle East. Do you really think that religion can serve as an effective tool, if you will, specifically to advance peace, communication, and tolerance, and thereby maybe reduce the friction and lessen tensions? In Africa, we had an event that we discussed some of these issues recently. In other words, can the clergy play a role to bring people together in conflict resolution and in regard to biothreats and so on?
Well, I mean, the short answer to that, of course, is yes, but I would broaden that to say that the leadership of all organizations, be it religious leaders, political leaders, business leaders. I mean, I've watched this pandemic unfold over the last 16 months, and it's really underscored for me the importance of visionary leadership at the top across the board. If you look at the US, for example, people here tend to self-identify as being of the right or of the left, which means they only go to those news media outlets that they agree with. And those outlets tend to follow the lead of that political leadership. And so until we get people at the top of organizations who are willing to be visionary leaders, who don't get into this transactional, it's a win-lose, but let's look at what's for the good of the body politic writ large. I don't think, I mean, a lot of these other ideas of the media doing certain things, they're great, except that the media tends to follow its audience. And if they've already self-identified as to which audience they're communicating to, that's the way they're going to do it. And so it takes leaders. Religious leaders play a huge role in convincing their followers to do and think in certain ways. So of course they can do that, whether it's a pandemic or whether it's violent extremism. But if they don't have the support of the political leadership, of the business leadership, then we're still in this fragmented, balkanized situation where, at least in the US, we have 50 states running in 52 different directions. This is something that it takes good leadership to correct.
Okay.
Yona, can I just add one of the things to what Charles just said? I think this was an excellent answer. I really appreciate it. I'd like to add something about the religious leader question. When I was in South Africa, I asked Bishop Tutu about the truth and reconciliation process. And he said, well, there was more truth than there was reconciliation. And the reality of it is truth is an important antidote to a lot of what we've been talking about. But I want to emphasize some reason beyond what you just said, which I think is really right on target. And that is that many of the things that we're worried about in today's society, we've inherited from the past. If you're a Muslim, the Crusades are a current event in many Muslim communities. And I don't need to go into slavery. And part of this is the transgenerational transmission of trauma. That people are re-traumatized by the stories that they hear from their elders. And I'm part Choctaw. I remember my grandmother telling me about the horrors of the Trail of Tears and how Aunt Flo's feet froze and all this happened, and first person type anecdotes about what happened. Well, I didn't realize until after she died at age 96, she was born 50 years after the Trail of Tears. She was spreading the trauma beyond that. Now, because I haven't been discriminated against on and on and on, like many Black people have been, I can understand that the trauma of slavery is alive and hurting people today. And religious leaders have an unusual ability to actually intercede and try to break the transgenerational transmission of trauma. And so I just wanted to add that as an answer. But Charles, I think you're right on target about the importance of leadership as well. Thank you.
I have to add that there's a genetic basis to this transmission. It's called epigenetics. And it's been demonstrated that trauma can be genetically transmitted once it's imposed and affected a generation. So that's, I think, an interesting aspect that we probably need to be looking at, combining your comments.
Yeah, let me just add to that, because Rita, I think you're absolutely right. One of the experts in this area is Vamek Volkan, V-O-L-K-A-N. He's a Turk who now lives for many generations, for many decades in the United States. And he is the founding father of the International Dialogue Initiative, which tries to look at the psychological problems that are barriers to peacemaking. And it's part of the International Dialogue Initiative, and it's on the web. But one of the things that Vamek has been telling people is that there is something there that's genetically handed down. And the epigenetics that you just mentioned, Rita, is something that really needs to be looked into, because it is entirely conceivable that something that happens, 2 or 3 generations ago could still be in our makeup, and we're susceptible to it. But if you can look up stuff that Vamek Volkan's written, it's fascinating stuff.
Well, the classic study was done on women, Dutch women, during the period of starvation when they were literally living on tulip bulbs.
I've read that study. Yeah, I saw that
And
study.
it's carried on into subsequent generations.
Wow. Thank you.
Okay, the clock is ticking as always. May I ask Professor Don Wallace for your view or question or comment?
Yona, I have many questions, but I noticed that Tevi Troy has joined us.
Oh, he joined us?
And you had so why don't you give the time to him, and I'll keep quiet.
No, well, you will have opportunity. Tevi, are you there?
Yes, I'm here. Thanks for having me.
Okay, thank you very much for coming. And perhaps, I don't know at what point you joined us, but at any rate, what's your view on the role of communication at this difficult pandemic?
Yeah, sure. Thanks. First, I'd like to say thank you to you, but also to Don for his very gracious ceding of the time to me. I appreciate that, Don. Look, I wrote a book a couple of years ago called Shall We Wake the President? It's about how presidents deal with disasters, but the number one thing I focus on there is communication, because a president doesn't make a vaccine, a president doesn't make a COVID test, a president doesn't do quarantine. A president communicates. That's their number one role. They can communicate in order to marshal resources within the federal government, which is a useful thing. They can also communicate to let the American people know what's going on. And I think when you have problematic communications from the top, I think it leads to a little skepticism. I think Fred earlier said something about how he mentioned the former president's name and was disappointed that he had to mention it or whatever. But I think it wasn't just from the Oval Office that we're having problematic communications in this last pandemic, but also from CDC and from some of the public health folks as well. I think multiple types of miscommunications and misleading communications. So for example, the initial mask guidance where they said, don't wear masks, but not because they didn't think masks were good, but because they said, well, don't wear masks. And secretly we want to hoard them for ourselves because we need them. And I understand that frontline healthcare workers need them. But if you had told the American people to go out there and make their own cloth masks, then the American people would have marshaled their resources and done that. So I think when you mislead the American people, either for political benefit, which we see from from politicians, or for what you think is their own good, which we often see from the public health officials, I think that leads to a lack of trust in leadership. And when we need in time of crisis more than anything else is trust in our leadership. So we know, is this something to panic over? Is this something we shelter in place over? Is this something that would allow us to continue to live our lives and go about our normal business? And so I think one of the #1 lessons that I took from this is more need for greater reliable communications from our leaders. And I know somebody was talking about the polarization in terms of some people watch Fox, some people watch MSNBC, but ideally we would like to get information in these circumstances that is transmitted the same way on Fox or on MSNBC or on CNN. We've got to know what we're dealing with so that we can deal with it.
Okay, Professor Don Wallace, you always have the last word.
We've listened to a very rich panel, and I would like to say that, like so many of these panels, there's just so much. Well, it's very impressive. I think we're all impressed. Even Rita herself is impressed, and that's something. I would say, I'm going to make a suggestion for a further program, but I just pick up on something Tevi Troy said. I mean, I think leadership, the absence of effective leadership, I would say, is the problem of modern democracy, period. And after all, it's the leader who ultimately is the ultimate communicator, obviously. And all of you said that. So I think this is the overall tragedy of our times. But Yona, to be practical, how about this as the next program? And this is a series, after all. And this is looking to the future, and it touches maybe more on policy as well as communication. Namely, I touched on it in my initial remark about COVAX. The pandemic continues. India is a grotesque example. I think the ambassador did not mention Brazil by name, but that would be another grotesque example. So the pandemic continues. Some parts of the world have been spared more than others. I do a lot of work in Africa. Fairly slight, the effect in sub-Saharan Africa, surprisingly. But we're going to have to distribute the vaccine. And it's becoming an issue already politically. Why has the United States not shared? In fact, it has shared. It's dumped, it made some of the AstraZeneca available in Canada and Mexico, rarely mentioned in the media, and I can see why they were restrained. So it seems to me we should have a panel on the next year. What will happen as the pandemic continues, as slowly but surely the vaccine is distributed in ways that will, of course, infuriate some and not others. And I think, how is that going to be communicated? If I were the president, I would worry about that, because I'm wanting to restore American leadership in the world. I think Biden said last night that once we get our own people injected, we're going to share with the world. Europe, in spite, I don't want to be unkind to the ambassador of Croatia, but I think finally, the lady von Leyen, is that her name, finally made a deal. I think, is it with Moderna or one of them, and she's going to acquire a lot of this. But Europe has to take care of itself. And I think it'd be very important to see how intelligent communicators will communicate the continuing problem of the pandemic, how we deal with it, and specifically how we distribute the vaccination and other assistance. I think that would be a valuable program for our series. That's it. Thank you.
Thank you very much for your contribution.
Okay.
Thank you.
Thank you, everyone. Take care.
Thank you.
Stay safe